masks have become a part of our lives, but some experts claim masking children is unscientific and can cause damage. Current research shows that children are less susceptible to COVID-19. Let's discuss this issue with the chair of the Ministerial Advisory Committee on COVID-19, Professor Barry Schoub. Very good morning to you. Is this true? Is it unscientific? Is it dangerous?
Good morning, Jane. I don't think there's any evidence that it's dangerous as such. I think the only reason it's not licensed for children is it hasn't been trialled in children. It hasn't been examined. Those clinical trials which are carried out are only carried out in adults. So there's a question mark. Is it safe? Is it not safe in children? Is it going to be effective or not effective in children? I think that's the question. But on general principles, we wouldn't really suspect that it's going to be harmful to children. In fact, there may be a case for some children who do have comorbidities to in fact vaccinate them. The only thing is it's not licensed for children. So it's not approved for children.
And there's mention of the saturation. So once you've been wearing it for a little bit and the mask is saturated, that this could possibly pose more harm than not. Is that correct?
Well, yeah, I guess if the mask is really totally saturated, it probably won't filter. You know, the air. The whole idea of the mask is to filter any infectious air droplets which will come from somebody who is infectious to protect the individual who's susceptible. So I guess if a mask is totally saturated, it may lose that ability to filter out the air. I think it would be a bit unusual for a mask to be totally saturated. You know, there's a little bit of saliva on the mask. I don't think that's going to do very much. I think the main important thing is that the mask is fitted correctly and is worn correctly. In other words, covering nose and mouth. You know, we often see people with the mask under the nose. That's not good. That's not going to help either way.
And Professor, what about oxygen deprivation? That was another cause for concern in this article.
Yeah.
Is that something that children can suffer from, and would it have long-term effects if they're not getting enough, if they're running with a mask, for example?
No, you know, there's been now quite a number of studies and shown conclusively there's no evidence that it's going to prevent that oxygen coming in is going to be in any way reduced. So I don't even need to worry about that. You know, if you can breathe normally and breathe adequately, you're going to get plenty of oxygen.
Okay, good. So we are okay with kids wearing masks. We can move on from that. Tell me something. We are slowly getting in vaccines. I mean, they really are trickling in to the country, which is rather alarming. Do you think we have enough? What do you make of the latest batches coming through? Where does this place us in the fight?
Yeah, look, Jane, you know, this is the kind of initial what you call phase one of the eventual vaccine rollout. So yes, this phase is going to go slowly because you are dependent on the Johnson & Johnson vaccine coming in. I don't think that is actually trailing behind. Obviously, we're all impatient to get phase two going after we've immunized our healthcare workers. But I think we always said it's going to take probably about 2 months to get through all the healthcare workers. Whether we're going to reach that goal, we'll have to see. I think the information I've got back from the people who are doing this, it's actually a study because it's implementation stage. You look, how is the vaccine faring? The feedback seems to be quite positive. So I'm not too concerned myself personally at this stage.
Just very briefly, I see that one of the countries, and the name escapes me now, has also walked away from AstraZeneca. So does that confirm that what we did was the right thing? Should we have just not issued them anyway, got the jabs into people's arms with it?
No, Jane. You see, I think the issue, I think what you refer to is Ireland.
Ireland,
no, I think those countries, those countries are doing it for a different reason. They're worried about one of the possible suspected side effects of the vaccine that might cause blood clots. Now, our reason for suspending AstraZeneca was completely different. We had no evidence that it is going to be effective against our particular variant. In fact, all the signs that we do have are in fact negative. The signs that we've got from the laboratory and also from some of the clinical studies that were done in the country don't suggest that it is going to be effective. So we couldn't really, in all due, really kind of give out a vaccine where all the signs are negative and there are no positive signs that it is going to work. We couldn't really go on a hunch that we suspect it may work. There wasn't evidence that it would work, and that's why we suspended it.
Okay, so thank you for that. When it comes to vaccines and masks, we seem to be on the right track. Professor Barry Schoub, thank you.
I think so. Thank you.
All right.